I almost feel like I'm losing credibility putting Kim Kardashian in this photo, but this is essential in my explanation of psoriasis because I want to show you that arguably one of the better looking people on this planet has psoriasis, and it's not that big of a deal. You just have to learn how to treat it. There are three types of psoriasis, mainly. There are different types of skin psoriasis, and it can cause arthritis and affect your nails as well. For the most part, I may be missing little details, but no big deal. So this is what psoriasis look like. It's a scaly, silvery plaque that appears in areas of irritation. And it's not only around the scalp right here, but it could be here. Could be on the bottom of your foot in the pressure areas. See how your arch doesn't have as much pressure, but everywhere else it has pressure. You could even have blistering in the pustular blister type. And you could have it around your midsection. But it's not always like this. It pops up like this when you have stresses. So people who are smokers, who have emotional stress, physical stress, a hard time breathing, hot and cold weather, that allergies, that kind of thing. There's a big list, but the bottom line is you get thick skin, you get some cracking, you get some redness, and you get some silver white scales on your skin. And the causes of psoriasis, there's not a definite cause. What happens is, to get into nitty gritty detail, genetically, the way you have blood types, you also have cell markers on your skin cells, and your immune system can sometimes attack them if you have certain types when you develop irritations. And it can start attacking them and causing blisters and kind of the hard skin you see right here. But it's also environmental. Like, it happens more in people who have mental and physical stresses, people who have infections, allergies. This is when these vesicles and these plaques kind of pop up. And you can also have psoriatic arthritis. This is the second thing that can happen. Basically, your joints in your forefoot and in your hands, in your hips, in your spine can decrease in motion and become kind of thicker and more brittle, hard bone with less joint motion. And this can lead to sausage digits, fingers, that kind of stuff. See how the joint right here, usually there should be a space between this toe joint, but right here it's fused together with like whiskers. So that can cause you a lot of pain. And then lastly, this is more a beauty thing, but you can have pitting, discoloration of your nails. They can turn brown, yellow, that kind of thing. In the treatment, I'm not really going to get into depth. If you really want to get into this, I go into much more depth on DetroitFootPain.com, and all the videos are free, everything's free, but I detail mostly home treatments, which are before this, but then once you get into medical treatments, we get into corticosteroids and TARs. These help decrease the thickness of the skin, especially in the foot. But the home treatments, I focus on the best moisturizers, how to rub the hard skin down, that kind of stuff. Then the next stage, if the topicals aren't really working, the steroid gels, the coal tars, phototherapy, so UV light, so kind of like a tanning salon, but special light that deactivates the white blood cells and prevents them from attacking your skin. And then systemic, for people who develop the arthritis, more of the pain, all the plaques here that I've shown you are extremely severe, and they would be on a systemic medication. But have hope. In the last 10 years alone, the advances have been extraordinary and things have become amazing. You should really be happy, because although having a disease such as this is very unpleasant, it's getting better and better every day, and it's something that you can very well decrease in symptoms and feel much better with. Do not try any of this at home alone without supervision. This is presented by Michigan Foot Doctors. If you think our information helped you, give us a thumbs up and come visit the site for even more.